NARCAN Nasal Spray is used to treat someone who has overdosed on opioids. It can be used to reverse the effects of the overdose until medical help arrives. While NARCAN Nasal Spray can be administered by a non-healthcare professional, it is not intended to be a substitute for emergency medical care. Before administering NARCAN Nasal Spray, always call 911 for emergency medical help. Do this immediately if you suspect or are aware of an opioid overdose. If you encounter someone who is unresponsive and you think they may have overdosed on opioids, first try to awaken them. Shake their shoulders, shout, ask them if they are okay, and firmly rub the middle of their chest. Check for signs of an opioid overdose, like passing out, very slow or irregular breathing, extreme drowsiness, pale and clammy skin, slow or no heartbeat, or small pupils. If you suspect an opioid overdose, immediately call 911 or ask someone to call for you. As soon as the 911 call is made, or while someone else is calling for you, administer the lowest available strength of NARCAN Nasal Spray. Note that while NARCAN Nasal Spray does not reduce the effects of an overdose caused by other drugs, giving it to a person because of a non-opioid overdose is unlikely to cause more harm. Before you give a dose of NARCAN Nasal Spray, lay the person on their back. Remove the device from its packaging and always review the printed Instructions for Use guide before giving them a dose. Do not test or prime the device as there is only one dose per device. Tilt the person's head back and provide support under their neck with your hand. Hold the device with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Gently insert the tip of the nozzle into one nostril. Your fingers should be right up against the nose. If giving to a child and the nozzle does not fit inside the nostril, make sure the nozzle seals the nostril before administering. Press the plunger firmly with your thumb to give the dose. After the dose has been delivered, remove the device from the nostril. After giving the person a dose of NARCAN Nasal Spray, move them onto their side into the recovery position, as this will help them have a clear airway. Watch them closely. If they do not wake up, or their breathing does not improve after 2 to 3 minutes, give them another dose of NARCAN Nasal Spray in the other nostril. Similarly, if they responded to the first dose, but experience a return of the signs of an overdose, give them another dose of NARCAN Nasal Spray. Be sure to alternate nostrils with each additional dose. When giving the person another dose, be sure to use a new NARCAN Nasal Spray device. Each device only contains a single dose. If you know how and if it is needed, perform artificial respiration or cardiac massage while you wait for emergency medical help to arrive. Be aware that you may need to help the person who received NARCAN Nasal Spray, as they may have a reaction such as becoming aggressive, shaking, and/or vomiting. You will also need to pay special attention when giving NARCAN Nasal Spray to a newborn who is less than 4 weeks old or a pregnant woman. Some of these reactions can be life-threatening for a newborn or a fetus. Remember, always call 911 before administering NARCAN Nasal Spray. This will ensure they get the help needed to deal with any overdose symptoms and any side effects. For more information on NARCAN Nasal Spray, talk to a healthcare professional, visit narcannasalspray.ca, or consult the product monograph.